probably one of those unique individuals that really didn't want to do any other type of medicine other than family medicine. And that came from my exposure as a young man to my family doctor, who was our family physician, and he was our friend, and lived in the community, and it was just what I was used to. When I decided to go to medical school and you start looking at training programs, the things that excited me the most were family medicine, because it was such a diverse area and such a diverse specialty. You had to be really on top of everything to be competent at what you did, and it was always exciting. And I was very fortunate to train in a United States Air Force residency training program where our work was intense, and we were able to deliver a lot of health care and had a lot of great training. The role of the family physician is to be the patient advocate and to be the director of care, and I may not be able to do a particular procedure, or I may not be able to make a particular diagnosis, but my role is to advise the patient, examine the patient, and devise a plan of care either that I deliver or I help orchestrate for the patient and make sure they get to the right types of consultants and providers. And then make sure that for follow-up care and long-term planning that everybody's on the same page. A lot of times, more and more, our role is as an advocate for the patient, to help guide them through the ever-changing and ever more complex healthcare model that we have in America. Because we are oftentimes the first and only contact patients have with healthcare, our job is to help educate and help plan for long-term care. And one of the parts of long-term care that's important is preventative care. And so one of our major jobs when we do a physical examination or when we do an intake on a patient is to take an overview of their risk factors and place some stratification, knowing when and how and what are their risks in the future for developing heart disease or cancer or diabetes or other medical issues. And then devise and educate them to what should be done and what the literature and what scientific research has said helps prevent long-term illness. My philosophy from the day I started my medical school training has been more of a total approach to the patient, and you know, patients don't walk in with a disease with a page number from a textbook. They walk in with a conglomeration of symptoms and a conglomeration of issues that lead you to a diagnosis, and my job is to manage that and to look at the totality of the patient and the totality of the situation to help them, number one, get better, number two, understand what they're dealing with, and then help me better understand how to help them. But I think if you look at a patient from a standpoint of them being a human being with wants and needs and fears and anxieties and questions and insecurities, then you're going to help them. And you know, the old saying in medicine, if you listen to the patient long enough, they'll tell you what's wrong, and that's oftentimes true. I've been in Wichita Falls since 1987. I came here on an assignment from the United States Air Force, and I was at Shepherd Air Force Base. I was married, and we had young children, and the community was very engaging. We had good access to schools. There was a sense of community here. It was a big enough town to get lost in a little bit, but it was a small enough town where you didn't get diluted out so much that you didn't have some of an impact. When I decided to stay in Wichita Falls to start my practice, one of the things that attracted me most to the community was the hospital system and the collegiality of the subspecialists that I got to work with. We had incredible support in general surgery and cardiology and pediatrics and OB-GYN, and we had a really solid base, and we still have a really solid group of hardworking, dedicated, like-in-mind type physicians that kind of shared the same philosophy that I had. And so it became very comfortable to practice medicine here. I felt it's important to be involved in a community because it's your home, and much like in medicine, it's more the totality of things. And so this was a good community to be involved in the arts and the cultures and the things that we like to do. And I got to watch my kids play in sports and attend high school events and have the kind of quality of life that I think is getting harder to get in the bigger communities because as we become more urbanized. And Wichita Falls has been, we're isolated enough, we're far enough away from the big metroplex areas where we still have an identity and we still have a sense of purpose and something different to offer to people. And so all those pieces of the puzzle have always been pretty good to me. And it's been a fun community to be involved in. One of the exciting things for me later in my career, I was involved in the beginning of the United Regional Physicians Group, Family Medicine and Primary Care Clinic. I was actually the first physician to be brought on board, and one of my tasks and jobs was to attract and bring in more doctors, more family physicians, and I'm really proud and proudest of the fact that we now have, with myself, we have 6 family physicians and 3 mid-level providers that are now engaged in the community, engaged in the practice here, and very, very proud of the fact that we have very compassionate, community-minded and well-trained physicians. They're all board certified. They're all fun people to be around, and they're all engaged in the totality of family medicine, and I think that's going to help this clinic grow. When people look at a community, one of the first things they look at are their schools and their health care. And I think we've gone, in 4.5 years, we've gone from an empty building to a thriving medical center with basically every type of diagnostic capability that you can need in family medicine, with laboratory and X-ray and MRI and subspecialty, and then access to the community. And it's going to be it's going to keep growing, and it's going to be something that's going to be here long after I'm gone, and that's always a good goal.